Now we are going to read about the intestinal protozoan infections. So in this chapter we will read about different protozoans which cause the intestinal infections, and in the book there are many protozoans given. Out of all of them we will read only three most important protozoans which cause the intestinal infections, that is the Entamoeba histolytica, Giardia, and the opportunistic Coccidian parasites which cause the intestinal infections. There are some other protozoan also which cause the infection like Balantidium, Microsporidia, etc. etc. We are least bothered about those, but we are more concerned or more focused on the three protozoans, that is Entamoeba histolytica, Giardia, and the opportunistic Coccidian parasites or the protozoans. So we will be focusing over these three. Now first let me clearly tell you that this chapter intestinal protozoan infection will be covered in three parts. The first part will be the introduction of all of these three protozoans or the parasites, and then in the second part of this chapter or second part of the video will be about the life cycle of these parasites, all the three parasites, and then the third part will be about the lab diagnosis of all these three parasites or the protozoans. Okay, so first coming to the Entamoeba histolytica. So Entamoeba histolytica comes from a group of protozoan called the intestinal amoebas. So intestinal amoebas, if you remember the classification of protozoa that I have taught to you all in the general parasitology, then you must remember that the Entamoeba histolytica belongs to the intestinal amoeba group. Okay, so in the intestinal amoeba group, this Entamoeba histolytica is the only Entamoeba which causes the infection. There are some other Entamoeba also, like the Entamoeba coli, Entamoeba dispar, Entamoeba Bangladeshi, Entamoeba moscowisci. So these are also Entamoeba, but they do not cause the infection. They are present as commensals in the intestine. They do not cause any harm. But this Entamoeba histolytica is not found in the intestine. It is not a commensal. It is present outside. Okay, so when it is ingested, when this Entamoeba histolytica is ingested through the contaminated food or water, then it causes the dysentery. Dysentery means what is the meaning of dysentery? Dysentery means diarrhea plus blood. Okay, that means if diarrhea occurs along with mucus and the blood, that is called as the dysentery. Now that dysentery can be caused by the amoeba as well as with the bacteria also, but here we are concerned about the amoebic dysentery. That means we will read about the Entamoeba histolytica which causes the amoebic dysentery. Okay, but mind, uh, uh, remember this, that the other Entamoeba, that means the Entamoeba coli, dispar, and Bangladeshi moscowisci, they do not cause any infection. They are commensals. Okay, but this histolytica is not a commensal. It causes dysentery. This should be clear in your mind. So now coming to the Entamoeba histolytica proper. So talking about specifically about the Entamoeba histolytica, first you should remember that it causes the amoebic dysentery. Then you should remember it has got three stages, that is the trophozoite stage, pre-cyst stage, and the cyst stage. So trophozoite stage is the invasive form, and if it is present in the stool, that means you can conclude that there is a active disease going on in the intestine lumen. And then we have the pre-cyst stage. Pre-cyst means just before the cyst stage. So this is also called as the intermediate stage because it is just before the cyst stage, and the cyst is the next stage in the life cycle of the Entamoeba histolytica, and it is the diagnostic form. This should be remembered, that the cyst stage is the diagnostic form, and it is present in the stool in both the carriers and the active disease person. So in both the persons who are carriers as well as in those who are having this active disease or the active amoebic dysentery, they pass these cysts in their stool, and if we are able to detect these cysts in their stool, then we can confirm that the patient is a carrier or it is or is suffering from the amoebic dysentery caused by Entamoeba histolytica. That we can be sure of. And then we have got the this is the introduction part of the Entamoeba histolytica. Then we will see a very important difference, that is the Entamoeba, between the Entamoeba histolytica and the E. coli. This is a very important difference. You should must remember, this is not a bacterial E. coli. Okay, E. coli here means Entamoeba coli. Okay, it is not Escherichia coli. Please don't make this mistake that this is not an Escherichia coli. This is Entamoeba coli. It is an amoeba, not a bacteria. Okay, and then here we have the Entamoeba histolytica. This is a commensal. Yeah, this is a commensal, but this is infective. This causes the dysentery. So this small thing or the basic things should be very clear in your mind. Now coming to the difference, because this difference is very important and very commonly asked in the university and as well as in the viva exams. So you should must remember this difference between the histolytica and the E. coli. And for remembering this difference, you have to remember the diagrams of the trophozoites of the Entamoeba histolytica and the E. coli. This is the trophozoite of the Entamoeba histolytica, and this is the trophozoite of the E. coli or the Entamoeba coli. Now, if you see the size, first consider the size of the trophozoite of the Entamoeba histolytica as well as the E. coli. Then we will see that the size of trophozoite of Entamoeba histolytica is 15 to 20 micrometer, while that of E. coli is 20 to 25 micrometer. Then if you see the cytoplasm, then it has got a clear differentiation between the ectoplasm and endoplasm. See here, this is the ectoplasm. Outside is part is the ectoplasm and inside part is endoplasm. And there is a clear differentiation. See, clearly there is clear space between all of them. There is no overlapping between the ectoplasm and the endoplasm. That's why it is called as the clear differentiation between the ectoplasm and endoplasm. But in case of E. coli or the Entamoeba coli, there is no clear differentiation. See here, the ectoplasm is here, then some ectoplasm is here, and the endoplasm is overlapping here. So there is no clear differentiation between the ectoplasm and the endoplasm. Now coming to the cytoplasmic inclusions. So in the cytoplasm of the trophozoite of the Entamoeba histolytica, we see RBCs, WBCs and the food vacuoles. While in the Entamoeba coli, we see that the RBCs are absent. Okay, although there may be WBCs or food vacuoles present in the Entamoeba coli also, but the RBCs are surely absent in the trophozoite of the Entamoeba coli. And if we talk about the nucleus, see here. First, let us talk about the cytoplasm inclusion. See, the RBCs are present here, but there is no RBC here. These are all the food vacuoles in the cytoplasm of the uh, Entamoeba. Sorry, yeah, Entamoeba coli, and this is the RBC present in the cytoplasm of the Entamoeba histolytica. So that is the difference between the cytoplasmic inclusions. Now coming to the nucleus. So in the nucleus we see that the karyosome is small and central. See, if we see this diagram, then you can clearly appreciate that this is the our central karyosome, and this is the nucleus. Okay, this is nucleus and this is central karyosome. So karyosome is present at the center of the nucleus. Well, if you see the Entamoeba coli nucleus, then you see this is the nucleus. While the karyosome is present at the corner, not at the center. That means it is a eccentric means eccentric. The meaning of eccentric is that it is present at a corner or towards the periphery of the nucleus. Okay, so this is the difference between the nucleus of the two. This is the difference between the nucleus of the two, that is the nucleus of the Entamoeba histolytica and the Entamoeba coli. Now coming to the cyst. So there is difference between the cyst of the Entamoeba histolytica and the Entamoeba coli as well. So if again we will go by the features of those cysts. So first we will talk about the size of the cyst of the Entamoeba histolytica as well as the size of cyst of the Entamoeba coli. So first, coming to the size of histolytica, we see the size is 12 to 15 micrometer, but the size in case of the coli is more, that is 15 to 25 micrometer. The size of trophozoite was also more for the coli, and this for cyst also the size is more for the coli. Okay, by that you can remember. And if you talk about nucleus, then the same as trophozoite, like there was the central nucleus, central karyosome, and the karyosome wall is small. Similarly here also, in the cyst stage also, the karyosome will be small and will be central. And if you talk about coli, then they are also similar to the trophozoites, like in the trophozoite of the E. coli, Entamoeba coli, the karyosome wall eccentric and relatively large. Here also it will be eccentric and relatively large. Now if we talk about nuclei, so nuclei varies in 1 to 4 in number. So there are about 1 to 4 nuclei. So if we see, this is the quadrinucleated cyst, there are 4 nuclei. Okay, there are 4 nuclei inside this cyst. That means it is a quadrinucleated cyst. So it is 1 to 4 nuclei in case of histolytica, but in case of coli there are 1 to 8 nuclei. See, count here: 1 2 3 4 5 6 7 8. So it has got 8 nuclei inside it. So cyst in case of coli has got 8 nuclei. So that's why it is called as octanucleated cyst. This was quadrinucleated, this is octanucleated cyst. So that is the difference between the nuclei of the coli and the histolytica. Remember, everything is more in case of the coli. The size was also more, the number of nuclei is also more, everything is more in case of nucleus. So uh, there is a the coli has a upper hand. Okay, by that you can remember. Then the chromatid body has not been shown here in these diagrams, but you can remember, if you want to remember, the chromatid body is thick bar shaped in case of histolytica, and it is filamentous in case of the coli. So this is the very important difference between the Entamoeba coli and the Entamoeba histolytica. You should remember, this is asked in the university exams, and this is important as well. Now coming to some MCQ points. So as I have talked about, the Entamoeba histolytica is not only the Entamoeba. There are some other Entamoeba also which are present as commensals in the intestine, like the Entamoeba dispar, Bangladeshi, and the Moscovisci. And they have got the morphological similarity. They have got morphological similarity in the trophozoite and the cyst. So if we see the trophozoite or the cyst of the dispar, Bangladeshi, or Moscovisci, they all will look similar to the histolytica. So you cannot differentiate that this is a cyst of Bangladeshi or Moscow whiskey or dispar, or this is a cyst of histolytica. You cannot differentiate like that, but you can differentiate by doing the PCR. So this may be asked as a MCQ in your questions. So PCR can be used to differentiate between the histolytica, dispar, Bangladeshi, and Moscow, but you cannot differentiate by microscopy. That's what I want to tell you, that it cannot be described by microscopy. PCR can be used to describe it. And this triage parasite panel, that can also not distinguish between the histolytica and dispar. We will see what is triage parasite panel. It is a method of diagnosis of the parasites. We will see about that later on, but for the time being you can remember that triage parasite panel can also not distinguish between the histolytica and the dispar. This was the introduction part of the Entamoeba histolytica. Now coming to the Giardia lamblia. So talking about the Giardia lamblia, in the Giardia lamblia, it causes giardiasis. It causes giardiasis, which is diarrhea. And remember, it is a watery diarrhea. It does not cause dysentery. If blood is present, you can surely say that it is not Giardia lamblia. Be sure that it is not Giardia lamblia if there is a history of dysentery. Only if there is history of diarrhea, simple diarrhea, then only you can think of the Giardia lamblia, or you can include the Giardia lamblia into your differential diagnosis. But once blood has been reported in this tool, then you cannot include Giardia lamblia into your differential diagnosis. So If blood is present, then go for any alternate diagnosis. So this is the only flagellated intestinal parasite protozoa. You should remember that Giardia has got a flagella in it also, and it exists in two forms. One is the pear-shaped trophozoite form and the tetranucleated cyst form. So this pear-shaped trophozoite stage is the invasive form. That means it is the infective form. In case of the Entamoeba histolytica, the infective form was the trophozoite stage, was the infective, and here the sorry, this pear-shaped trophozoite is not the infective form, rather it is the invasive form. That means it invades into the tissues. And the tetranucleated cyst is both the infective and the diagnostic form. While in case of histolytica, the trophozoite was the invasive form and the cyst was the diagnostic form. But here, the tetranucleated cyst is the infective as well as the diagnostic form. Knowing this much about Giardia lamblia as an introduction is more than enough. Now coming to the next group of Coccidian parasites and or the intestinal protozoans, that is the opportunistic Coccidian infections or opportunistic Coccidian parasites. And these are the Cryptosporidium. These are the Cryptosporidium, Cyclospora cyatenensis, and the Cystoisospora belli. Okay, these are the three opportunistic Coccidian parasites. So in the Cryptosporidium we have got two species, that is Cryptosporidium parvum and the Cryptosporidium hominis. So if we come to the Cryptosporidium infection, it differs from the Cyclospora and the Cystoisospora in 3 points. This may be asked in the explain why question. You know, all of you know that recently the pattern of the questions has been changed in the NMC guidelines, that there will be at least 4 or 5 explain why questions in each paper. So this question may be asked as the explain why question in your university exams. Like the question can be asked like uh, why Cryptosporidium infection is different from the Cycloisospora and the Cystoisospora. So you should remember these 3 points to write in the exams as the answer to that question. So why this Cryptosporidium infection is different from the Cyclospora and Cystoisospora? Because in the Cryptosporidium, autoinfection is observed, which is not seen in the Cycloisospora and the Cyclospora and the Cystoisospora. And the second difference is that the oocyst released in the feces is sporulated, which is not the case in case of Cyclospora and the Cystoisospora. So in case of Cryptosporidium, the oocyst is sporulated, but in case of Cyclospora and the Cystoisospora, the oocyst is not sporulated. Then sporulation of the oocyst occur in the intestine in case of Cryptosporidium, but this sporulation does not occur in the Cyclospora and the Cystoisospora. That means if the sporulation is occurring in the in the Cryptosporidium, that means obviously there will be production of sporulated oocyst. If there is no sporulation, like in case of Cyclospora and Cystoisospora, that means they will not produce the sporulated oocyst. This is simply all of them are related to each other. And if it is sporulated, that means if the same hand is used for eating something, then of course there will be auto infection. Okay, so all of these 3 points are related to each other. Okay, so if we remember that the sporulation of the oocyst occurs in case of the Cryptosporidium only, but not in case of Cyclospora and the Cystoisospora, then you can remember all these 3 points. How? Because if the sporulation will occur, then sporulated oocyst will be produced, which is not the case in case of this Cyclospora and the Cystoisospora. And if sporulated oocyst is getting passed through the feces, that means of course there will be auto infection present, because the same hand if used for eating something or eating food, then through that contaminated hand there will be ingestion of those sporulated oocyst will be, which will cause the auto infection. So of course these 3 points will occur in case of the cryptosporidium. In case of the cryptosporidium, that's why the cryptosporidium infection differs from the cyclospora and the cystoisospora. Now I have made the some diagrams of the cysts. If you practice these diagrams, then the features can you can remember for longer duration. If you want to practice them, then you can do, otherwise leave this. So this is the cyst of the Giardia lamblia. See this, it has got a cyst wall, it has got an exonym, and there are four nucleus. Then this is the sporulated oocyst of the cryptosporidium, where you have got the cyst wall and four sporozoites are there inside the inside these sporulated oocyst. While this is of the cyclospora, where in the cyst wall there are two sporocysts, and in both of these sporocysts we have got sporozoites. Two sporozoites are present in both of these sporocysts. While this is of this Cystoisospora belli, where again you have got two sporocysts, but the sporozoites are four in each one of them. So this is the difference between the Cyclospora and the Cystoisospora sporulated cyst. This is all about the first part, or the introduction part of the the intestinal protozoan infection. Next we will see about the life cycle of all of these three parasites in the all of these three protozoans in the second part of the video. In a single page we will cover that, so that is going to be a very great video. You must should see that video. And in the third part we will discuss the live diagnosis of all of these three all of these three infections or three parasites or protozoas. Okay, so that's all for the introduction part of these three parasites.